guys, Dr. Will Adams here, chiropractic physician at Miami Spine and Performance. Today we're going to do our first whiteboard chat with the docs. What we want to do is we want to talk to you guys about specific topics within healthcare, fitness, chiropractic, nutrition, functional medicine, things like that. Just to give you guys a little bit of more information about what we do here at the clinic, but also just to spread education. We tell people all the time when we do workshops that we love treating patients in the clinic. It's definitely our biggest passion, but just below that is community education. So we figured since we can't reach as many of you guys right now directly as we'd like to, we want to do sort of an educational series that we're going to be uploading through our social media and through our YouTube. And today, what I want to talk about for our first topic is a four-letter word, pain. And what I want to talk about specific to pain is what is pain, and is having pain, does it necessarily mean that you need to stop what you're doing and you shouldn't be doing any activity? There's a lot of misunderstanding around pain because pain is not just a physiological phenomenon, but it's also psychological, right? And we know, particularly in patients that have chronic pain, that physiological inflammatory pain that people generally think of starts to blend with more of a chronic central nervous system type of pain. And before I get into this lecture, I want to give a quick caveat, which is that if you are experiencing pain, you should see a professional and get a thorough assessment, right? Because not all pain is the same, and these rules apply in the context of seeing a clinician. So this is really just meant to be educational. This isn't giving out medical advice. Always seek medical advice from your physician, not from the internet. With that being said, we're going to talk about pain today, and pain is a topic that we talk about in the clinic every day because most of the people that come to see us are coming to see us because they're in pain and because that pain is affecting their quality of life somehow, whether it's their ability to work, their ability to do things at home with their kids, and very often their ability to do the exercise that they love, right? And pain can change very dramatically from day to day. It can be very subjective at times. You could have a bad day at work or a bad day at home, and this could change your pain level, right? If we're talking about a 1 to 10 scale, you could get really stressed out about something and your pain could shoot up, or you could watch a great movie, laugh at some friends, and you wouldn't even notice you had pain. Whereas more objective measures, functional measures like range of motion, like muscle strength, like functional movements, your ability to squat, gait, things like that, those are a lot more objective, and those aren't generally going to change with situations. Those require neurological and biological adaptations. And in our clinic, we're always looking at making those neurological and biological adaptations. That's how we use the chiropractic adjustment. That's why we use manual therapy. That's why we always integrate some sort of active component with our patients. Any of you watching that have been to our clinic as a patient before, you're probably already well versed in this stuff, but we always give worksheets to patients. We give you guys things to go home and work on because we know that we can make very profound neurological changes here in the clinic, right? Through chiropractic manipulation, through manual therapy, through education, we can change neurology, but biology takes time, right? True hip internal rotation, true ankle dorsiflexion. It takes time, it takes work, just like going to the gym and getting in shape. So we try to guide you guys to make those biological adaptations on your own, and we handle the neurology side so that you guys can go home and do those exercises. With that being said, sometimes pain doesn't always follow function, right? Sometimes we get tissue sliding and gliding together well, right? We work out soft tissue adhesions, we work out joint fixations through manipulation, we fix movement mechanics, we work on breathing, we work on joint range of motion, and everything looks good, and the person says, well, doc, this is great, but I still have pain, right? So we have to have that pain conversation, right? And whether you're a clinician, whether you're a trainer, whether you're a patient or somebody dealing with pain, you never want to neglect pain, right? Because it's always part of the equation. As functional as you want to be, as much as you want to be a movement person, you just can't ignore pain, and it's very multidimensional. And one of the people that I personally think describes pain in the clinical context of being a conservative musculoskeletal doctor is Annie O'Connor and her co-author Melissa Kolsky in their book, A World of Hurt. And I probably read this book cover to cover every 6 months. because this book is so important and it describes pain in such a wonderful way. And I constantly read it because I'm constantly educating patients on the things that this book talks about. And one of the most profound parts about pain that this book talks about is something called a traffic light system. And of everything I educate my patients on, whether it be breathing, whether it be using their intrinsic foot muscles, there's a lot of things that people are surprised by and kind of walk out of the clinic going, gee, I never even thought about this before. But the pain traffic light guide is one that really reframes the way that people look at pain, period, going forward, okay? And so with the traffic light guide, what we're gonna look at is a green light, a yellow light, and a red light, okay? Green, yellow, red. Now I wish I had colored markers, that would make this a lot better, but we don't, so we're gonna do with what we have. And what this means is we're looking at pain during activity and pain after activity, right? So someone will come in and say, Doc, I went for a run and my ankle hurt. But then when I stopped running, my ankle stops hurting, right? So that's pain during activity, right? Doc, when I back squat, I feel pain in my back. But when I rack the bar and I walk away, the pain goes away, right? Pain during activity. Now, if somebody does an activity, so for instance, I went cycling, I felt great. But after I got off my bike and I sat down, boy, my knee was aching. It hurt. It was painful, right? That's pain after activity. And then, of course, there's cases where, okay, when I bench press, my shoulder hurts, and then it kind of continues to hurt. Like it's a little sore for the next 10 minutes, for the next day, for the next week, right? So there's a lot of variables to consider. Every condition behaves a little bit differently. And the first thing that we do in our clinic, and the first thing that you should be thinking about if you have pain, is how does that condition behave, right? Do you have pain during movement, pain after movement, or both, right? Then the next thing I want you to think about is, what is the intensity of that pain from baseline, right? And nobody likes rating pain 0 through 10. We don't even like it as doctors. I don't like quantifying pain like that. It's difficult because, again, a 9 to this person and a 9 to this person could be drastically different. So really, it doesn't give us a lot of good information except a measuring stick of where to go. It's like using a scale that's 20 pounds off. Well, it's not going to give you accurate weight, but if you lose 20 pounds and use the same scale, then you probably actually lost 20 pounds, right? So we're going to use that pain scale, okay? So let's say that you're somebody that has no pain in your shoulder unless you bench press. So you have 0 throughout the day. Then you do a bench press and your pain spikes up to a 4. You rack the bar, you get up, a minute later, your pain goes away. Now the question that you should be asking is that pain safe? Is that pain okay? Because sometimes in rehab, we give exercises that are a little bit painful, but again, prescribed by a doctor. You don't prescribe these for yourself, but sometimes as doctors, as therapists, we do give exercises that are painful because we need to remodel tissue, right? We need to desensitize tissue. So we're looking at pain during and pain after. So an example of a green light would be, again, somebody that has no shoulder pain, they go to bench press and their pain spikes to no more than a 4, let's say, okay? 4 out of 10. But then right after they bench press, they have no pain, okay? So within a few minutes, it goes away. That's a green light. And what that tells us is add 1 to 5% for next session. And that usually blows people away because they think, well, no, it hurts when I bench press. I shouldn't be bench pressing, right? And in a lot of cases, that's true. But there are cases where there is good pain. There is pain that you actually need to experience to desensitize your body and progress through rehab, right? If you have a 1 out of 10 pain doing a bicep curl in your elbow and it goes away right after, well, you can't just stop doing curls forever, right? You don't want to do that because then you'll develop fibrosis and then you'll just never get over it. So the first thing we try to educate people on is this green light. And the cornerstones of the green light, there's really 3. Number 1, the pain during the activity doesn't spike above a 4 or maybe a 5. We're definitely not in that 7 to 10 range. Definitely not. If your pain spikes to a 7 to 10, stop what you're doing. okay? But anything, 2, 3, 4, 5 during activity. And then after activity, within, let's say, 15 to 30 minutes, the pain goes away, right? Even 15 minutes later, 15 to 30 minutes later, pain goes away and you're back to baseline. So you're back to that 0. And if it's a 2, then you're back to that 2. It doesn't have to go down to a 0. Number 3 is the harm check. And the harm check is your range of motion, right? So if we're talking about the shoulder, we're talking, let's say flexion, abduction, external rotation, internal rotation. You need to have a couple ranges of motion in mind that you're going to check before and after the activity. So if you have, this much external rotation and this much flexion, you do a set of bench press, you feel a little bit of tenderness in the front of your shoulder, and then afterwards your pain goes back to baseline and you do your harm check and you have the same amount of range of motion, you didn't just damage that shoulder. You did not do any structural damage to that shoulder. What you're looking for is a loss of range of motion. If you have pain coupled with mechanical changes, meaning changes in range of motion, then we're starting to look at a yellow or a red light at that point, right? We really don't want an activity to drop our range of motion below baseline. So that's a green light. A yellow light means you should keep doing what you're doing, right? Keep doing what you're doing. And an example of a yellow light is you have 0 out of 10 shoulder pain, you go to do your bench press, and then your pain spikes up again, okay, maybe a 5, and then it lingers for a bit. Maybe it lingers for an hour or 2 afterwards, or maybe a little bit later that day. But again, in the same day, in the same 24-hour cycle, back to baseline. Okay, we bench pressed at noon. By dinner time, we're back to baseline, right? We know that we probably, and again, the range of motion did not change significantly, right? We still have at least 90% of our range of motion. It feels about the same. We know that activity, though it was painful, it wasn't harmful. It hurt, but it wasn't harmful, right? But that's not the kind of activity, something that lingers for a few hours afterwards, spikes up to a 5. It's not really something that we want to progress, right? So the next time you go to bench press, we're going to use the same weight, we're going to use the same volume, the same intensity, right? So that's the upper limit of what we consider safe pain, safe rehab. The red light, stop, consult your physician, or drop the weight. That would be pain that spikes during the activity. Again, 6, 7, 8, 9, 10, particularly those upper 4. And you see a major loss in range of motion, right? So you have, let's say you walk around with 3 out of 10 shoulder pain. You do a set of bench press, man, 8 out of 10 in the shoulder. It's screaming. I also can't lift my shoulder over my head anymore, and I could before. That's a red light. That's a no-go. At that point, you're putting yourself at risk. Not necessarily did you do harm to yourself, but you're certainly putting yourself at risk for harm. That's when you consult a physician right there. When you see those major changes in range of motion, you see those major spikes in pain, and pain that, doc, I had 8 out of 10 pain for 3 days, for a week, right? That's when you may have really hurt yourself. And a lot of these injuries that happen, it's something that hurts in the gym, the pain really spikes, all of a sudden they come into our clinic, the shoulder doesn't move the way it used to, and the pain has lingered, right? Most people, if pain comes and goes, they might not even seek out a clinician or a doctor about it, right? So that's our red light. So just to review, green light, do the activity. Pain spikes up no more than a 4 or 5. It doesn't last more than 15 to 30 minutes. And we lose no range of motion. Yellow light, pain spikes up again to that 4, 5, maybe 6 range, but it lingers for a couple hours. It lingers for an afternoon or something like that for the rest of the morning. But then it goes back to baseline and we do our harm check and we didn't lose any range of motion. That's the upper limit of what we want to do. We don't want to go past that until that activity becomes a green light, in which case we progress 1 to 5%, not 25%. Red light, we do an activity, our pain spikes to a 7 through 10, and it lingers for a day or days, and we have a major loss of range of motion. Cut that activity off. You're putting yourself at risk for actually structurally harming the area, and it's time to do a physician consultation and figure out what's going on. Again, guys, these are meant to be educational guidelines. Always consult your physician about exercise, about pain. If you are experiencing discomfort during an activity, you want to consult, your physician, your chiropractor, your therapist. Somebody who's educated on this can give you a proper diagnosis and can point you in the direction of therapy. But these are a couple concepts that we talk to our patients about, and the things that are written in World of Hurt regard to this traffic light guide are extremely well researched. So there is a lot of literature out there to support this. So you can look into pain science yourself. It's incredibly interesting. It's a whole rabbit hole, and it's a whole topic in itself that you could study for a lifetime. But we just want to give you guys a little insight, and we look forward to seeing you for our next whiteboard chat with the docs. Thanks.